Patients with locally advanced squamous cell carcinoma of the head and neck and with high-risk relapse face significant challenges in long-term disease control. The NIVOPOSTOP phase 3 trial evaluated nivolumab as a post-operative treatment component to determine whether adding immunotherapy to the standard of care, which is radiotherapy and cisplatin, will improve disease-free survival. The study aimed to assess whether nivolumab, when combined with the standard of care radiotherapy and cisplatin, will enhance disease-free survival compared to the current standard treatment alone. Researchers had analyzed the disease-free survival events at a predetermined threshold, and the results confirmed a clear advantage for patients receiving nivolumab-based therapy. Nivolumab demonstrated superiority over the standard of care, which is cisplatin radiotherapy, in high-risk locally advanced squamous cell carcinoma of head and neck cancer patients, marking the first major advancement in decades for this group of patients. This trial had met its primary endpoint, which is the disease-free survival, demonstrating a statistically significant and clinically meaningful disease-free survival benefit with a hazard ratio of 0.76 across all patient groups. The 3-year disease-free survival was 52.5% with the chemoradiation therapy versus 63.1% with the nivo in addition to chemoradiation therapy. The safety profile of the nivolumab was consistent with previous studies, and the treatment compliance remained similar between the two trial arms. A trend toward overall survival improvement was observed through OS will undergo final evaluation at a later analysis. These findings have the potential to be practice-changing. If the OS results confirm the benefit, nivolumab will be incorporated into post-operative treatment for high-risk locally advanced squamous cell carcinoma of head and neck. The trial represents a major shift in how we proceed post-operative care for locally advanced squamous cell carcinoma of the head and neck. This is the first time in over 2 decades an immunotherapy regimen has demonstrated superior disease-free survival over the standard of care of cisplatin radiotherapy combination. If OS data further support its efficacy, we may see a new standard of care emerge, potentially transforming adjuvant treatment in such group of patients.